to how not to fall. It's called something a little different, but posture, balance, and body mechanics. We have Alexandra here from Symbria. I will let her speak a little bit on herself and the Symbria team, and she is going to give us a presentation. And I know a lot of you have some questions about how to fall or how to get up from falling. And so it being September is Fall Awareness Month, and so let's give a hand for Alexandra. And I'm going to fix a little technical difficulty. Okay, hello. I'm Alexandra. I'm an occupational therapist, and I'm the program manager of our therapy department here with Symbria. Our therapy team is occupational therapist, that's me, physical therapy, and speech therapy. And together, one of our biggest jobs is fall prevention, or rehab after a fall. Let's start with one of the handouts, because it is a little questionnaire that you can do to kind of assess your fall risk. So it's the Balance and Falls questionnaire. Okay, so the questions. Have you lost your balance or fallen in the past 6 months? And I actually have, but I'm usually I'm usually doing something that I shouldn't, and I know that. But okay, do you generally feel weak and unstable during activities of daily living? So getting out of bed, sitting down or getting up from a chair, and feeling unsteady when you're walking. So that's kind of goes into one of the things about your balance and fall prevention is your strength. Do you have a visual impairment? Are you taking more than 3 medications? There are a lot of medications that actually can affect your fall risk. So those are important to know. Do you have high or low blood pressure? Anybody who's gotten up really quick and felt that whoosh of your body as your blood pressure dips down low, I'm sure you can imagine that can definitely make you feel unsteady and can increase your fall risk. Do you feel lower extremity weakness? And is this affecting your activities of daily living? So leg weakness, that affects how you do things in your everyday life. Do you have sensory loss in your feet due to diabetes or nerve damage? So that neuropathy in your feet. Of course, if you can't feel your feet, it makes it difficult to stay upright. Have you suffered a stroke that has affected the function of your arms or legs? Do you have neurological conditions, Parkinson's, multiple sclerosis, or a history of a stroke? Do you have pain that is limiting your movements or activities of daily living? I think pain is a factor that is often overlooked, but when you're in a lot of pain, you're going to be changing your movement. It's not going to be as sort of free, but you're really going to be stiffening up, and all of that actually makes you more likely to fall. And then this is probably the source of at least 2 of my falls. Do you have a pet that crosses your walking path at times, causing you to lose your balance? And in my case, usually she's pulling me down, but they're always in my way. Okay. So that's a little questionnaire, and you can think about that. You can fill it out. Okay, so, all right, so a little bit of statistics here. Falls are the leading cause of death over the age of 75, and the number 2 cause of injury-related death among those 65 to 75. It is a very big just cause of debility later in life. Almost 50% of older persons who experience a fall resulting in serious injury never fully recover, and many lose at least some of their independence with their daily activities and with their mobility. Common fractures involve one or more of the following. So the pelvis, the hip, your thigh bone, your femur, any of your vertebrae, your humerus, your upper arm, your hand and your forearm. In fact, when you go to brace yourself from a fall and you break your wrist, it's called like a foosh. So it even has a nickname because it's so common. It's a fall on an outstretched hand. And then the ankle. So older adults who have fallen previously or who stumble frequently are 2 to 3 times more likely to fall again in the next year. Oh, okay. All right. Okay. Just a few more facts. 1 in 4 older adults will fall, and more than 50% won't tell their doctor. So, falling once doubles the chances of falling again. 1 in 5 falls cause serious injuries, such as a broken bone or a head injury. And then many people who fall, even if they're not injured, develop fear. And that kind of comes back to, not moving as normally as you would, which makes you more likely to fall. And then fear may cause a person to cut down on their everyday activities. I hear that a lot. I'm afraid to fall, so I don't do that anymore. And that just makes your muscles more weak. It makes your body even more, it gets out of the habit of having to balance. So you lose that. Okay, and then the definition of terms. So your posture is the position of body parts with respect to each other. So your head over your shoulders, over your hips, over your ankles. You're always trying to keep that really tall, upright posture. It's actually much easier for your body to balance when all of your body parts are in line with each other. It takes a lot less energy to balance when everything is all in a line. Stability and balance are very related, and they get mixed up easily. So stability relates to the maximum distance someone can lean in any direction before having to alter their base of support. So if I lean forward, I'm still able to keep my weight over my feet. But if I lean forward far enough, I have to step in order to change where my base of support is, where my feet are in relation to my main weight. And then balance is the ability to control your center of gravity with respect to your base of support, whether you're stationary or moving. So if you think about just sitting at the edge of the bed, You have to be able to balance there. You're not moving, but you don't have any support, around your back, or even hands on the bed, and you have to sit. Or when you're walking and you're moving, and you have to be able to control where you are. So why is balance so important? Balance is a skill that requires both body and mind coordination. Balance is actually a very complex skill, and you need to be able to control where your body is at all times in order to keep it where you want it to be. So it's both a matter of your physical body and your mind being able to control that. Like every other skill, it takes practice. We do a lot of balance practice in therapy, a lot. I think you never have too much of it. It is so important. It's so complex. Standing is the activity that requires balance the most. And aging often leads people to sit more than they stand. And so that practice that you get just in everyday life, you're not getting quite as much practice when you spend more time sitting. And then you need good balance for just about everything. You need good balance to walk. You need good balance to get up out of a chair, to lean over, even when you're sitting down, leaning over to tie your shoes, it takes that balance. Okay, and then falling is not a wait and see approach. So we have to be proactive. All right, so all the components that go into balance. Factors that contribute to a decline are that loss of muscle, your loss of strength. So if you're not exercising as much, if you're not doing as much in your life, whether that's because you've had a fall and you become fearful, or just a change of routine, that creates that loss of muscle and that loss of strength, which in turn further challenges your balance. A decrease in fast twitch muscle response, that's a long way to say it's a decreased ability for your muscles to quickly change your position in space, so that quick response. And then postural changes. Any leaning forward or changes to your back, those all make it much more difficult to balance. A shifting in the center of gravity, cognitive changes, like concentration and awareness, and then the speed at which you walk also has a contribution. So the three big systems that go into balance is your visual, your vestibular, and then the somatosensory. So your vestibular system is in your inner ear, and that is a very delicate system that is activated with changes to where your head is in space, to movement of your head, and it works with your vision. And the two together know where you are in space and are constantly readjusting you to the horizon. They're critical for maintaining upright balance, and especially when other systems are not available or are distorted. So visual changes as well. So changes in the peripheral vision system reduce how clearly you see. They can reduce how much you see. sometimes you can see in front of you, but you lose sort of that side-to-side vision, or even up and down. And then the ability to see contrast between colors or between items. And then those changes actually alter the quality of the information that you're receiving from your environment. So you might have been able to see in great detail before, and now that environment, it just isn't looking the same. And then that's going to result in just a slower processing time for all of that information that you're getting, because it's not as clear, and it takes more attention to kind of process it. And then other visual changes, presbyopia is not being able to see short distances, so I'm supposed to wear reading glasses now. Cataracts, glaucoma, and then macular degeneration is also one that probably most people are familiar with. That changes your acuity. And then there's the system that less people are familiar with, the somatosensory system. So that provides information of spatial location and movement. And that just means that in your joints and in your muscles, you have this sensory system that lets you know where your body is in space. So not only does it tell me, okay, my feet are on the ground, my body is upright, but if I close my eyes and I move my arm, I can feel that, and I still know where my arm is in space. And that's because of that information coming to me from my joints. All right. Oh, thank you. I know, hydration is important. That's right. Thank you so much. Okay. They're very wordy slides. So, okay. So changes to your body are going to impact your balance and your equilibrium. So basically, exercisers, people that exercise, score higher in reaction time, lessened degree of sway. So when you're trying to balance on one foot or 2 feet, and you have that little, that little sway, people who exercise have a little bit less of that. And then the improved leg strength for stability. All of that reduces your fall risk. So balance is a complex function involving all of those systems, your visual, your vestibular, and your muscles and joints. So it is all of those things together. Okay. There's a lot of conditions that you guys might be familiar with that are going to impact your ability to balance. So disc degeneration is going to change your posture. So lordosis, kyphosis, and scoliosis are all just ways of explaining how the back curvature changes. So it can change so that you have too much of a curve in your low back, or too much of a curve in your upper back. And then scoliosis is when you have sort of a sideways curve, and it can be a little bit, or it can be pretty significant and cause not only balance issues but also quite a bit of pain. Weak core muscles can lead to a lot more force on your back. Lack of activity That's going to impact your mobility. It's going to impact your functioning, your ability to do your daily tasks. Loss of flexibility. This is definitely one that a lot of people are guilty of forgetting about. I definitely have lately. But your ability to be flexible is not just touching your toes, but it's even being able to get a good stride in. You have to have some flexibility in the front of your hip. So there is a lot. And then decreases in joint range of motion. So whether that's your hips or your knees or even sometimes your ankles, all of those things play a really big role in how you're able to control your movement. And then cartilage deterioration, it's very much the same as disc degeneration. It's going to change how your joints are functioning. And then bone density. I know this is a very big worry of mine. That bone density, it's going to increase your risk of breaking something if something does happen. Okay. And then the benefits of spending the time and working on your balance. You're going to prevent the incidence of something happening that you're not going to be able to fully recover from. So breaking that hip or your arm. Improve self-confidence. You won't be as fearful. You'll feel good walking down the hall and doing everything in your daily life. Of course, increased independence. And then working on your balance, preventing falls. So body mechanics we talk a lot about body mechanics when we're lifting things. I think probably is the way that most people know it. So if I'm going to pick up something heavy from the floor, I wouldn't lean over like that, because I might not get back up. That would really hurt your back. So, using your legs and your bum to lean over and get something. Holding something close to you, if it's something heavy, holding it close to you, so that you're not stressing out your muscles and your joints. If you hold something out here, it takes a lot more than if you hold it nice and close. So it's about kind of protecting your body and your joints as you're going about your daily life. So it uses the muscles appropriately without stressing them, and it protects your joints from stress or pain. And it's not just your big joints when you're picking up something heavy, but a lot of us forget about the body mechanics of our fingers and our thumb. Somebody was just asking me today, actually, about arthritis in the hand. And we definitely tend to overuse our thumb and our fingers. And I'm very guilty of this, but I just have to get that jar open, and I'm not asking my husband for help, and it's hurting me, and I don't care. And that is actually causing a lot of stress to these little tiny joints that really can't take that much stress. And then when you're doing something properly and without pain, of course, it's going to build that confidence. Okay, so the CDC's 2020 report has these facts. So up to 50% of those between 55 and 65 do not participate in any form of movement activity. And that percentage just goes higher over 65. That's a lot of people that aren't exercising or even doing fun sports that are just for enjoyment. Inactivity leads to major deterioration in strength, flexibility, and balance, leading to an increased risk of falls. So it's like that. If you don't use it, you lose it, right? Physical activity has a major impact on decreasing fall risk, managing chronic conditions, reducing depression, or premature death. So exercising, whether that's in a formal exercise class or just doing something fun, it has an enormous benefit to not only your physical health, but reducing your stress, reducing signs and symptoms of depression. It's huge in benefiting your overall happiness. Okay, and then this slide is kind of the same as the questionnaire that we did at the beginning. So it's kind of why did those questions matter? Why is it those questions? Well, if you have fallen in the last year, you are more likely to fall again. If you've been advised to use a cane or a walker, you may already be unsteady. You may already be at risk to fall. So that unsteadiness or holding on to furniture when you're getting around in your apartment, that's a sign that you don't feel comfortable, that you don't feel that your balance is really where it should be. People who are worried about falling are more likely to fall because you tense up. And then, so this is one I don't think it was on our thing. So if you stand up from a chair and you have to push up, it's a sign that your leg muscles could maybe be strengthened, which would help in reducing that fall risk. And then it's kind of the same thing with stepping up to a curb. If you ever have trouble stepping up on just a one curb, that's a sign of just decreased leg strength. And then a couple of the other things. If you often feel like you are rushing to the toilet, rushing anywhere is obviously, it's going to put you at risk to fall. That loss in your feet, the numbness is going to cause stumbles. And then the medications, a lot of medications make you feel lightheaded or tired, or maybe sometimes even a little foggy. Okay. I'm gonna skip this one because we don't actually have this at our building. But there is, if you guys are ever at your doctor's office and they ask you about this, it's like a AI evaluation. Basically, the camera looks at you moving and it can sort of calibrate your risk for falling. Okay. So how can I help you? So with physical therapy, if you see a physical therapist for falls or for balance, they're going to work on your muscle strengthening. They're going to work on strengthening those leg muscles, your hip muscles. They're going to work on flexibility and stability. They're going to work on balance-specific exercises to challenge your balance so that the right muscles and nerves are firing when you do need that balance. They're going to train you in the use of a cane or a walker if that is the correct step. And then my favorite, they're going to work on core training. Nobody likes to do it, but it is really, really important to train your core, to strengthen your core. It's a huge part of not only reducing back pain, but in keeping your body upright as you're moving your limbs through space. OT, that's what I am. So your occupational therapist is going to talk a lot about your body mechanics. So how do you go about your daily life in a way that's not putting your joints at risk, or not putting your whole self at risk because of how far you're having to reach into your refrigerator or for that door or into your closet. So a lot of it is changing how you do things to make it a little bit safer. Kind of along the same lines as joint protection. Occupational therapy is the one with all the toys. So we have lots of adaptive equipment that just makes life easier. So I always say, if you're having trouble with something, ask me, because there's always somebody that already had that trouble and invented something to help you. There's always something. You either have or know of those little reachers, the grabbers, that'll help you get something far away or help you get something on the floor. There's just a ton. Joint integrity, same thing, joint protection. Trying to use your body in a way, or changing and how you do things or how you place things in a way that just keeps your body safe. And then ADL training and adaptive techniques, all that means is that we have all those little tools, or sometimes just changing the way that you do something can make it a lot more accessible. So even, if you don't have the range of motion in your shoulders, I've got another way to put on your shirt. So it's tons and tons of ways that we can modify things so that you keep your independence. And then, why should you spend so much time on strength? Strength training. Strength is a huge part of your balance. So just to reduce your fall risk, it's really important to work on your strength. When you do strength training, you are also working on bone strengthening. Your bones will build themselves up in response to muscles pulling at them. So that's a really important part of strength training. Better vitality. You're going to feel better. You're going to do more. Bone density stabilization, that's the bone strength. And then sleep improvement. I think this is actually a big one. It's a factor that we could go into for a while, but the more you exercise during the day, the more you tell your body, this is when we're up and we're active, and then going to bed at night, you're able to sleep better. When you sleep better, you're less likely to fall. So it is really important. Okay. So some exercises that you can do. And you can practice these. You're probably familiar with a ton. Do you want to be? Okay. Let's see. Let's see if I can read and show you these.
Looks like there's if you got it's kind of far.
No.
Yeah, I know.
I can see that there are words there.
Right.
Yeah. Okay, so of the seated exercises, you've got your knee lift. This is just marching in place, okay? And I know it doesn't seem like a lot, but actually, if you do this without leaning against your chair, this is a core strengthening exercise. So, it's actually a really good one. And it'll get your heart rate up. Ankle circles. Okay, and this has the added benefit, if you straighten out your knee, that you're also strengthening your thigh muscles. So you just circle those ankles. It's actually really important when you take those steps for good walking mechanics. Pointing and flexing also. Okay, pointing and flexing your toes. You're gonna do this, huh? Okay, so sitting at the edge of this is like in a chair sit-ups. And you can, you can put the closer you are to the edge of your chair, the more work you have to do. So you can kind of curl your belly in a little bit, okay? Lean back, tap, and come back up. Lean back, tap, and come back up. Yeah. They're.
We're gonna add these.
Oh.
It's a Monday class.
I'm sorry.
Thank Alexandra.
No, but they're good for you. Okay, and front kicks. So that's your leg raises.
I have a question.
Yes.
How would you modify, or if I what if it hurt my back? Would I tell a resident obviously not to do that? But
Yeah.
how would I know if I'm?
How would you know
Should
if
I
it
go
hurts?
or use this as a little assistant?
You certainly can if you need a little bit of assistance with your arms. I think what's really important is that you brace your belly, which is kind of a weird thing. But bracing your belly, the weirdest but best way to describe it is if somebody is about to punch you in your belly, you do that bracing. That's exactly what it is, and that's what you should do when you're doing any core exercise. So that's the most important thing, is bracing that belly. That'll protect your back. And then if you do have any back issues, you would want to be doing just a little bit and really focusing on that bracing of the belly. And sometimes I've even had people where for whatever reasons they really can't do that at all, but we have to work on their core. And what I'll have them do is actually not move at all and work on that, pulling that belly in. Okay, so you're kind of like anterior, posterior pelvic tilts.
Perfect. Thank you.
Okay. Okay. You got your front kicks. Okay. And the way to make this even better is to hold up at the top. Yeah. Okay. This is sort of an intermediate between sitting and standing. We do these a lot, and they can be done in several ways depending on what muscles you want to work. So sit to stands with a chair. So you can either do it as sort of up like that, just lifting your bum up, and I'm straightening through my arm. And when I do that, I'm actually working the back of my arms. Okay, so that's one thing. Or, okay, you can stand and then really slowly lower, and you can kind of hover with your hands here. That's a lot in your legs. So working on that controlled sit back down is a really good way to strengthen your legs. And actually, I think just standing up from a chair is a whole body movement. It's an incredibly important movement in your daily life. It strengthens your core, it strengthens your legs, it strengthens your arms. So it's a fantastic exercise. Okay, so standing. You can always hold on to a counter or the chair. You probably do that a lot. Let me see here. Okay, so if you're holding on to something, you can raise onto your tiptoes and come back down. It's really good for strengthening your calves, but also you get that flexibility in your ankles, which is important. Toe touches out to the side. You get to work the outside of your hips, which is incredibly important in the strength of your legs and in your balance. So weight shifting, we do this a lot in therapy. It's just shifting foot to foot. Sometimes not lifting your feet, just kind of feeling that weight shift front to back, side to side, okay? And then partial squats is it's like you're maybe almost gonna sit down into a chair, sticking your bum out. Yep. Side leg lifts is the same as the other one, so just working on that outside of your hip. Stepping up and down. If you have access to like,
We've used this before.
okay,
Class.
yeah, just the one step. We do this all the time. Just having a step up, whether you stay on one leg, yeah, you do, or alternating gives your other leg a little bit of a break. And then sidestepping. So if you're at a counter and you're holding onto the counter, having to sidestep one way and then the other way, you're working those the outside of your hip again. So those are really important, and I think exercises like that are extremely important in challenging your balance in a way that is actually used in your everyday life. So when you're going about your life and you're in your kitchen, you're going into your fridge, you're stepping back, you're reaching up, you're stepping back, you're going to we have a lot of small movements like this that is actually a lot more difficult to balance than if you're walking straight down the hallway. Okay, let's see here. I think we might be coming to the end. Yeah. All right. So this is basically just that all of these systems are here to help, and they're all important. So that pharmacy, your physician, your nurse should be watching your medications to make sure that you don't have ones that you kind of need to look out for if you are going to be challenging your balance. Your therapist to work on your strength and your balance and your posture. And then well-being, and I think that's where Beth comes in. So keep on with those exercise programs, and yeah.
Let's give her a hand.
Yes. Oh, do you want
He doesn't need a mic. I got
No, I don't need one.
I didn't think so.
2 points.
He doesn't need one, but
First, our team here does all these things for us. Without doubt, everything you've shown is done.
Yes,
by our team.
absolutely.
Another point, maybe it's 3 points. For what? Joyce? You can't hear me, Joyce? Oh. Water, the advantage of the water exercises, which reduces the fear of falling that you overcome.
Yes.
And the third one, I probably forgot. That one you don't teach us how to do. But what's equally important is how do we get up if we do fall?
Okay. Yeah, so, one, can I tell you that Mason Pointe actually has just about the best well-being program, the best activities program that I've ever seen, and I've worked in a lot of facilities, so, yeah.
Okay.
And I totally agree about water aerobics. I used to do pool therapy, and I just absolutely loved what I could do in the water, what people can do in the water, and it really builds up your confidence. It's amazing. Okay, so if you've fallen and you are not injured, you're able to get back up, okay? And there's maybe a chair nearby.
Stable chair.
A stable chair nearby, like your recliner or something like that, something that is not going to move if you push up onto it, okay? What I would want you to do is get onto your hands and knees. So if you are able to get to a chair without too much strain, okay? I would never want you to strain. But if you're able to do that and you can get to a chair, if you can get to your hands and knees, hands up on the chair, preferably both, not holding a microphone, 1 foot under you, other foot under you. And if you can get to that chair, that would be absolutely perfect.
How do you assess if you're injured or not when you're on the floor?
So,
Repeat
usually, what?
the question, sorry.
Oh, I'm sorry. So she asked, how do you assess if you are injured or not? Usually you're going to have a good amount of pain, but not always. Sometimes you've actually broken something and you don't know it yet.
Your adrenaline.
Your adrenaline. I'm like the queen of breaking bones. Goes back to that falling problem that I have. But I've broken a lot of bones, and usually right when it happens, it kind of hurts, but it's not that terrible. And then you don't do anything, and then in a few hours, you're in such excruciating pain that you know that it's broken. So you don't always know. If you have any pain at all, and there is a phone nearby, which I hope there is always a cell phone or your call button, one of those things should always be right there with you. If there is any sort of pain at all, don't take the chance. Just call. Yes, sir.
Anyone who falls and has a head injury should be mandatory to
Yes.
the emergency room as quick as possible.
That is absolutely true. So if you hit your head at all, you're supposed to have it checked out. So you have to press that call button or call 911. You have to get it assessed. That's one that you might not be able to assess yourself. Like you might not feel anything weird, especially at first. So if you hit your head at all, you do have to get checked out right away. Did that answer your question, sir?
Oh yeah, in there, done that.
Okay. Yes, ma'am.
To wear the right kind of shoes.
Oh,
To wear the right kind of shoes at all times. I wore, early in May, I wore some sandals with foam underneath, and I fell in the hallway coming to church here. And I broke the femur in my left leg. And I ended up on the other side in the hospital for quite a while, and it was painful.
Yeah.
So I knew I broke something.
yes.
So just wear the right kind of shoes.
The right kind of shoes.
Yeah.
So, I almost always wear sneakers. So closed toe, closed heel shoes, something that's not going to slip off your feet. If getting shoes on is difficult, they actually make these amazing shoes now. Skechers is probably like the most popular brand, but a lot of brands make these shoes that you just step right into it, and the heel kind of does something funny, and it's just on your foot, and it's a sneaker. So you don't have to bend down, and they're not very expensive, and so they're an amazing option to have those correct shoes on and put them on yourself. Any more questions? Anybody have a question? Yes, sir.
How do I get a copy of that? How do I get a copy of the simple exercises?
Is it right here?
I believe I gave you one. Yeah. Do you need one?
Yep. No, you got it.
Okay.
That's your seated exercise and other.
Second page.
But
We do a lot of those in our 1 o'clock classes, Monday through Thursday. A lot of the exercises that she went over, John and I are doing those in the classes. Of course, you can do them on your own as well. But yeah, we are doing those a lot. We're doing a lot of those, all of those exercises actually in our 1 to 1:30 classes, Monday through Thursday. And even on Friday, the 1 o'clock class is a balance and floor routine. So I think if you, even if you're not really the kind of person that goes to a group exercise class, maybe just going for a couple of times until you feel comfortable with the exercises, or you know, because sometimes, especially with arm exercises, it's really important how you're moving your shoulders and how your posture is, so that you're protecting your joints. And so sometimes it's good to get that feedback. I will tell you that I like group exercise classes because I'm held accountable, and so when I get tired or I just don't want to go, I still do it. So I get that energy from everybody else, and it's just more fun to exercise with your friends. So,
good point. I like that she stated that if group exercise is not for you, but just coming 1 or 2 times or a one-off, just reach out to John. He'll go over all the exercises with you. But yeah, if being a part of a group isn't, you know, if you don't want to exercise in a big group setting, but I wholeheartedly know that everyone should be doing some form of activity or exercise, and it should be enjoyable. So
yes, absolutely.
any other questions?
I just have a comment. Many years ago, I was told that when you get up out of bed, you don't just
automatically just start walking. Walk like a penguin, and that's much better for your balance because you're not trying to put one foot in front of the other. Walk like a penguin, getting up out of a chair or getting up quick out of bed to go to the restroom or whatever. That's what I've been told.
I don't think I've ever heard that
Jan
one.
can demonstrate for us here.
well, just walk with your legs apart. Like
Oh, I see what you're saying.
one foot in front of the other.
Yeah, I see.
I was taught that long while.
That could be. I think, you know, I think a lot of people, they get into the habit of almost like walking on a tightrope, which is really hard. So maybe that's what they were referring to as when you're walking, you kind of want to walk with your feet hip width apart.
Yeah.
It'll be much easier.
I'm gonna piggyback off that. A good way is like if you're in the store and you see, you know how the floor is laid out, like here's the squares, here are the squares. Ideally, your left foot is in this lane, your right foot stays in this lane, and they're never crossing over. That's a way to. Ken, you got another question?
No. What you just said can be synthesized. Rise, stabilize, motorize.
I like it, Ken. There you go. Stabilize, motorize. Any other questions for Miss Alexandria? Oh, we got one from Kay back here. There you go, Kay.
How do you feel about walking with a cane just to keep yourself steady? Is that not a good thing, or?
It's okay. I would say that if you feel like you need a cane, then getting some physical therapy to work on your balance, to work on your strength is probably a good idea.
Okay.
Yeah.
Thank you.
Do we have any more? questions? Any other questions?
Barb Kelly?
What does the pace at which you walk affect your balance? You know, walking slow or walking quickly, how does that affect it?
Okay. So the statistics are that people who walk a little bit quicker have more leg strength and are better. They have a little bit more balance and confidence. That being said, the more you're rushing, if you're rushing to get somewhere and you're way more likely to fall. So, so I would definitely keep your pace down to prevent those falls. Yeah. Yeah. Yes, sir.
Ma'am in the back.
I have a cane and I walk with it part of the time. I have a cane and I walk with it part of the time, but I feel that it slows me down tremendously. What's your reaction to that? I walk much slower if I have a cane.
You walk slower with the cane, or you walk?
Oh yes, much slower.
You walk slower with the cane.
Yeah. You place the cane down. That's another additional action slows you down.
Yeah, I would say that if you feel like sometimes you should use that cane, then you're probably a little bit safer with it. Again, that might be something where maybe a physical therapist could kind of show you how to use it a little bit more to your advantage. Sometimes, doctors tell you, okay, you need this walker, you need this cane, and then you just get it, but you've never been shown how to use it. And so sometimes it's just a matter of, oh, okay, if I do it this way, then it works a little bit better for me. It would be good to get an assessment and see if you really are safer at that slower speed.
How do we convince them that it's okay to slow down a little bit, like you just said? I don't know if he's felt he's falling, so if you want to speed up, like why?
Yeah.
What's the urgency?
Yeah. So, I think this kind of comes back to your question about the speed at which we do things. So if you are going too quick, you're more likely to fall. So just reducing your pace goes a long way in preventing your falls. Not carrying items when you're walking. There's a lot of ways in which we can just change how we do things, but slowing down is actually one of those big ways.
And unless you're really mindful too, I think the cane it helps you.
A reminder
unless,
to slow down.
Yeah, the cane is your to help you be mindful, to keep you from falling.
Mm-hmm.
The thing I'm perpetually told is be conscious of your feet and taking a long step. How do you feel about that?
So usually what we want is that good heel to toe. Sometimes when you're not feeling as confident or as muscles get weaker, you tend to shuffle your feet. You don't pick them up as well. That's going to lead to tripping and falling. Or it's just an indication that those muscles that are going to prevent falling are not where they should be. You're also not as flexible. So sometimes it's more that this type of walking where you're not really reaching out with the foot is actually an indication that maybe something can be just worked on a little bit so that you do have better balance. Did that answer your question?
Honestly, it does not.
So I think that if there's a question and you've been told, okay, this is the way that you need it to be, without a whole lot of training or exercise or just, more information given to you as well, then seeing a physical therapist or seeing an occupational therapist to get that information that really should have come with the cane or the walker, I think is going to help too. And getting a good assessment from somebody, where we can test your balance and test your gait. Yes.
I guess the different, how would they know if they need a cane or a walker?
So we would do an assessment.
With their assessment.
We would do an assessment. That's about stability. If you're able to walk with the cane and that's all you need to stabilize, and we would just do an assessment for that. So a lot of things like that, we are really looking at every individual. It's hard to say all of these things will work for all of these people. You really have to work one-on-one. Yes, sir. It's okay.
It tends that my loved ones give me a lot of advice, but they don't always.
They do that.
Who's a professional in walking?
She is.
So I'm the occupational therapist.
But do you
Probably
know-
my physical therapist friends are the absolute professionals that will be able to assess exactly how you're walking, exactly how you're using that cane, and exactly what your balance is.
You do not work here, do you?
I do. Yeah.
From Symbria. You want to talk about Symbria?
Yeah. My company is Symbria. We're the therapy company that is here in the building. So we are upstairs on the third floor. Third floor. We have a therapy gym. We go to independent living all the time. We're everywhere. So we're right in the building. Yeah, and we have occupational, physical, and speech therapies.
How did they get
So if you are interested in getting more information on physical therapy or occupational therapy, please reach out to me or Beth would be perfect, and then I can set all that up with you or talk to you about what your needs are. Absolutely.
Between us two, we'll get the insurance straightened out and the session scheduled and all that.
Absolutely.
Good. Thank you.
Absolutely. Thank you all for having me. I appreciate it.
Now everyone's going to walk safely back to their apartments. Okay.